Okay, so welcome. I'm Shankar. I'm one of the GPs in the digital transformation team in the NHS England London region. But it's not just me alone. Several members of our team are on this call, and we're trying to help you get the most out of this session. Thank you for coming. We know how busy you are in primary care, so we really do appreciate you turning up. Much appreciated. What are we going to do? Well, we're going to do it all topsy-turvy. What on earth do I mean by this? Normally, if I was trying to explain something, I'd try to get you to understand it, then feel comfortable with it, and then tell you how to switch it on. We're going to do the totally the other way round. We're going to show you how to turn it on, and then to have pickups on the discussion maybe afterwards and what to expect. Why am I doing it this way? Well, we know you're busy, so it means that you just need to know exactly how to turn it on. You can literally just see the beginning of this webinar, and if you need to jump back into your work, that's absolutely fine. Also means that as a reference material, if this is recorded, if there's a slide deck, all the useful stuff will be at the front. So hopefully it will work if it's a bit strange, but let's see how this goes. So first of all, a very quick introduction and overview before we kick off in how to enable it. Yes, I know it's a really busy slide, but I think it's really important because it's so confusing, isn't it? GP Connect is a brand, I think, which is used for so many different functionality. And the biggest risk is we don't understand which each one is. We confuse them when we turn on and off the wrong thing. So let me demystify this and what we're going to cover in this session. The first thing is GP Connect Update Record. So let's be really clear. This is when you as a GP practice can receive structured coded consultation summaries direct into your GP clinical system. And to be even clearer, this is just limited to community pharmacies. It cannot be expanded beyond that role without agreement with stakeholders. So that's GP Connect Update Record. The second functionality you're really going to understand is GP Connect Access Record. And there's two parts to this, which we're covering today. The HTML bit. This enables sort of NHS or social care organisations with appropriate rights to access the patient's GP record as an unstructured document. The way that I see it is just as like almost like a PDF viewable type format. It's not sort of structured. It's not coded. Just a view. The next element is GP Connect Access Record Structured. Now it makes it far more usable. The structured view means that it's coded, machine readable, and it can be pulled into different systems. So it's just more user friendly. You can see sections, you can navigate it better. So this is a bit of first confusion we need to think about. Update record is stuff coming into us at GP practices, and access record is that other organizations can access some of that GP record. One thing to be really clear is patient consent is required with the access record. You have to check that the patient is happy to access view the record for that organisation. What this is not about is all these other GP Connect bits. It's not about a send document. You may not have even heard of what on earth that is. Don't worry, you're not alone. GP Connect Access Record Access Document, that enables another bit of access of documents we have in our GP system. It's not about appointment management. And this was, I would look as the original GP Connect. When we think GP Connect, we often think appointment management. And then GP Connect messaging, where you can send consultations to other practices. So all of this stuff which you could get confused with, we're not covering today. But really make sure that when you're thinking GP Connect, we've got to talk about the components we're talking about. Otherwise, we're all going to get confused. Practices are due to enable GP Connect Update Record, this one up here, and Access Record, HTML Unstructured, these two down here. They're due to do this by the 1st of October as required by the contract. So let's go straight into this topsy-turvy world of showing you how to do it. And let's start off in order of London. So most of our practices are on EMIS, then we're followed by SystmOne, and then we've got Medicus. So that's the way we're going to go for it. So here is GP Update Record enabling for EMIS Web. Optum Help Center has a really useful guide. So that's a QR code to scan you to get in. You do need to log in now to access it. And there's a link. Remember, all the slides are going to be shared. And when you do get the slides, everything will be clickable. So if you can't scan the QR code, you can just click on it to find things. So here are the key bits that the Help Center tells us to do. So first of all, you should be switched on by default. Having said that, you might have turned it off, particularly last year, following the collective action. So either way, if you think you're turned on or turned off, always useful to check. You can control the functionality by going into organizational configuration, select edit organization, so then you'll get this big pop-up screen. If you scroll down to the option, accept GP Connect update record via mesh, you've just got to make sure that is on yes, and you've got to click OK to save. That is it. You might be prompted to restart EMIS Web, but that should only take you seconds. That is enabling GP Connect to update record. What happens then? Well, you start to receive them into EMIS Web. You get them through your, into Workflow Manager. So if you go into Workflow Manager, you go to Documents Management, you'll probably find them in awaiting coding. So you start to receive them from pharmacies this way. Previously, you would have probably received them by NHS Mail. I know it gets complicated, but there's about 4 different pharmacy IT systems. And sometimes if you had to change your NHS Mail, you've got to make sure all different 4 systems have the correct email address for the pharmacy. So for your practice. This reduces that confusion. They're all enabled then with this same system. They can send it to you directly into your EMIS. When you do click on the tabs, this is just giving you an illustration of how it looks when you look at the details and you click on document. So that's how you receive it. What does it look like? So in EMIS Web, it's automatically filed. What on earth does that mean? It means that before you've reviewed it, it's filed into the patient's record like this. It has a clear marker saying provisional. It's making it clear that someone in the practice hasn't reviewed it yet in workflow. As you can see, there's structured information in here. It's not just a random PDF. It's structured like a consultation would be, and elements are coded. But just to highlight again, it is marked as provisional because you haven't yet reviewed it in workflow. That was update record. Now let's fly by into enabling GP Connect access record, HTML unstructured. Hopefully this jargon is starting to sink in, but those second and third component I showed you on that first slide. So EMIS Web, again, this is another help page dedicated to access record. Unhelpfully, they've just enabled it enabling GP Connect, so it just makes all that confusion comes in. If only they could tweak that. The QR code again, if you need to get into that page. So how do you enable this? So from the big EMIS ball, you go to configuration, you then click on organizational configuration there. From that point on, if you look down here, the bottom left-hand corner, you've got the organization there. You click on edit, and then you select down here GP Connect configuration. From here, the highlighted things are the sections you need to alter. Sorry, I'm just seeing a message that someone can't see the slide. I personally think if that's an issue, you might need to leave and rejoin. But if anyone else is having problems, please do comment in the chat. But anyway, let's carry on. So here we have GP Connect. We need to highlight here HTML view, and we've also got structured record here as well. So those are the 2 things we've got to make sure that we've enabled and clicked on. So that was the EMIS enabling. Let's now move on to TPP SystmOne. So all of you EMIS practices, you can just multitask while we go through these slides. So with SystmOne, again, they've got a useful help page. This is the page here in a QR code. You don't need to log in to access this, and there is a video that explains many of the elements. To enable it, GP Connect Update Record, again, by default, it should have been enabled for you automatically when it was rolled out. If you might have adjusted the settings last year, or regardless, I would recommend that you just check how you set up. How do you find it? Go to Organizational Preferences, Interoperability, Incoming Messages. If you look down here, you can see the options. You should be on file automatically. That's a default setting. That's a bit like what you just saw from EMIS. It is provisionally filed into the patient's record before you reviewed it, and it's automatically hidden online from the patient in that setting. That should be how you set up, and that's what we would generally recommend. But TPP practices have got another option beyond what EMIS has got. You've got a second option here. So if you look at that screen, you had the file automatically. You've also got this one, create task for manual filing. What does it mean by manual filing? It means that it comes in like as a task. We'll show that in a second, but it isn't provisionally filed. So until you've reviewed that task, it's not filed into the patient's record. So no staff member can see it in the journal until you've actually filed it. So that's how it works as if you want to pick the manual filing option. A couple of tips for SystmOne users. I'd recommend that you create a task rule. This is when you can create a rule that all tasks coming in will now have that sort of task category, GP Connect Update Record message. You could make sure it gets assigned to a particular team to manage. And remember, TPP is encouraging users to move away from user groups to teams. So please do think that through as a practice too. How's it arrive in SystmOne? Again, it arrives as a whole list of tasks with those different task categories based on the consultation. So whether it's a minor illness consultation, a blood pressure check, or a contraception service encounter. When you do get the tasks in SystmOne, you cannot bulk action them. You have to action them individually. And this is how it looks. Like you saw from the EMIS shot, it's structured in the record with coded information and coded medication. So that was GP Connect update record for SystmOne. Now we're moving on to how to enable GP Connect access record for SystmOne. So again, we go to organizational preferences, we go to interoperability, third-party record settings. So we need to select here. We need to select all these three ticks here. So select enable access record HTML, select enable access structured record provider medication and allergies, and then also select this long list here, enable access structured record provider immunizations, consultations, problems, investigations, outbound referrals, diary entries, recalls, and categorized data. Whoa, what a list. If you're an EMIS user, you don't need to worry, that's all kind of done for you in your options. There you have it. So we've gone through at a race with EMIS and TPP. We want to keep this fast for you. That's all recorded. In London, though, we do have a few practices on Medicus. So we're now going to just cover what happens with Medicus. So with Medicus, apart from this slide just slipping, it's not yet live with GP Connect update record, but you are automatically set up to receive the pharmacies directly through Mesh. So you basically get an experience. It's coming directly to clinical system, but it's not coded and structured at the moment. But you'll find it in your workflow module as inbound documents. What you do need to think about enabling is GP Connect access record. This is in the process of being rolled out by Medicus. So effectively, when you go to third-party data sharing GP Connect configuration screen, you need to enable here access record HTML, access record structured, and again, select this whole long list of clinical areas like what you saw in the TPP experience. So that's how you enable GP Connect access record in Medicus. I know that is fast. I know I may have lost a lot of you. Just remember, we want to keep this fast. So if you wanted to know the enable, you've got your time back. You can drop off. This is recorded. But if you now want to see a bit of what to expect and what the discussion around this all is, stay tuned. So what to expect? Here's some screenshots of minor illness, a patient having a minor illness. So here's an Optum EMIS web experience here. So again, you can see it's structured, coded. They've coded the main problem. And again, with TPP, that's a kind of how it looks there. So just a couple of things I'm going to mention. Some of the codes we might think are not optimal. For example, it says here coded seen in primary care establishment. It's not coding seen in pharmacy. So you may think that that's a bit obvious, but that may be something that can evolve in the future. Other thing is the code that's been used here, community pharmacy consultation service for minor illness. That's a legacy code that reflects the predecessor to pharmacy first. When CPCS was existed, it rolled into pharmacy first, the minor illness pathway. So you may think that some of these codes are not exactly as you might expect, and obviously we'd hope that new SystmOne codes arrive and the codes start to evolve. In the TPP journey, one thing I would mention here is everything is hidden on for the patient online, which is obviously in some ways good, that when it comes in provisionally, that the patient can't see it until you reviewed it. There could be something sensitive, for example, a contraception encounter. Having said that, I think we are going to forget to unhide it. So a lot of these will remain probably hidden from the patient, even if it's not sensitive. So just something to be aware of from there. Community pharmacy blood pressure check service. This is how this looks. So again, coded blood pressure reading. By the way, I've redacted a lot of information where it says pharmacist name, pharmacy. So if you think it doesn't show that information, it does. It's just that I've tried to cover it up in case anyone's sensitive about that. One point I will flag, and this is that there is an example, it's made look a bit blurred, that pharmacies are not meant to use GP Connect update record to communicate tasks or action for general practice. They're meant to communicate us to us separately, either by calling us or emailing us. But I think you might find some tasks still hidden in there, or at least signposting. And this is one example where a blood pressure is high and they've kind of navigated the patient to maybe go to see their GP practice. So you'd hope that the onus is for the patient to contact us, so it's signposting. But you could think that there are still some actions or workflow to general practice that may be still in that update record encounter. Here's a similar experience for TPP. So again, you can see that's coding, and it does also code the service, so the community pharmacy blood pressure check service for you. And then finally, the contraception service has got it listed here as the blood pressure, shows a BMI, and it shows the contraception that was prescribed. Now here on TPP, I've just given an example of a very busy consultation. This was an initiation where there's a lot of blurb, a lot of safety net information, which has come through in the consultation. So there we have it. We've gone through really how to enable. We've gone through maybe what to expect from how that consultation should look in a clinical system. Now we go on to the bigger section about discussion and questions. Okay, how do I put it? At the moment, I think there is, you may be aware, and I believe in transparency. If you weren't aware, there's a position that's come out from the BMA RCGP about how they view GP Connect Update Record. So the first thing I want to really highlight is they've mentioned GP Connect Update Record. It's not GP Connect Access Records. So let's be really clear on that. If you didn't see their position, it's here. So I'm being really transparent. It's a letter, there's a QR code, so you can see their thoughts on it, and you're welcome to reflect on it. So I'm not going to try and tell you what to do. I'm not going to tell you to do one thing or another. I'm going to just reach out to you with some thoughts as a user of my experiences or my thoughts about this. I do think GP Connect Update Record reduces your workload compared to receiving by email. And even though we may think, should all of it be in the GP records, I think often when we do receive anything by email from other organisations, we often do cut and paste it, drag it into our clinical system, either as an attachment or something. So I just want to throw it out there. Well, wouldn't you normally, if you got the pharmacy report by email, still put it into the GP record? So does it save your admin time workload? Secondly, that patient experience. I think auto-filing can be a good thing. Patient just literally had that encounter with a pharmacist. They contact your receptionist saying, well, the pharmacist said this. The pharmacist, your receptionist may be clueless, thinking, well, there's nothing in the record. I don't know how to manage this. When it's provisionally filed, at least you can see that entry, that you can empower your receptionist to understand what to do. It could reduce duplication of contact, extra workload picking things up. So I do think that's potentially another advantage, both from the patient experience and also from a practice experience to help navigate it with auto filing. Coding. Now, coded information, to me, that could be good and bad things about coding. We may have views about blood pressure coding, but the good thing is it's searchable, it's trackable, even as a fail-safe. Even if you as a practice didn't spot a pharmacy high blood pressure reading, maybe when you're doing a review, reports of high blood pressure readings, it's going to navigate it. So I do think it as a fail-safe. And even if there was a wrong code, at least you can search in it, not like a free text or a large PDF that got scanned in. So I think that could be one advantage. I find it personally easier to spot medication. You might have an encounter with a patient and you're about to think of something, and then you realise that very clearly that they've just seen the pharmacist 2 days ago, they've been prescribed an antibiotic. Sometimes the patient forgets to mention to us things that have been supplied by the pharmacy. So actually it saves you time maybe with history taken and so forth, that you can see what has happened and it's very clear in the GP records. It can also avoid you making a prescribing error about thinking about, prescribe another antibiotic, not realising they're already been given one by the pharmacist. And this is a bit which we do need to think about reaching out about our roles. It helps the pharmacist with understanding what has happened with the patient if they've seen another pharmacist. This may not make sense to you, but the faster we save it into the patient's GP record, the faster that any pharmacist might be able to see it on either summary care record or with a GP Connect Access record. So if a patient went to one pharmacist one day and then the next day went to another pharmacist, maybe shopping around for a different opinion, they can see that more reliably if we have update record enabled, because we're going to be faster to process it. That still may not make sense. You may not feel it's our role, but it can lead to a safer and a better experience for both the patients and the pharmacies. So I'm going to leave you with this final thought of this discussion before we open up to questions. I can see that things are not perfect. I've shown you some imperfections even with code selection. Are we not seeing this as maybe a journey of collaboration? We are improving communication with some of this, with Access Record and Connect Record. We're empowering pharmacies to maybe do more with more information. The IT is clearly evolving. We're all clearly learning from this. And all of this is hopefully leading to better patient safety and experience. So I'm going to stop my presentation at this time, start to open up for questions. But before I do go, I was asked by, in fact, it was by Shani in Northwest London ICB saying, do you know it's the World Pharmacist Day on the 25th of September? Well, I didn't know. So just putting that up there in the top left-hand corner. So apparently on the 25th, it's World Pharmacist Day. So maybe topical for the webinar today. Okay, so where do we want to start with any questions that we feel we can answer? And by the way, if you feel that the slides are definitely going to be shared, the recording's going to be shared as well. But if you do want to raise any questions, you can post them in the chat. We'll see if we can answer them. We did want to keep this as a really fast webinar and a resource for busy practices. So so that's why we've gone really fast. But the slides will be shared really quickly with the recording, so you can go at your own speed about your settings.
Shankar,
Okay.
there is one
Yeah.
asking, please kindly repeat the steps for EMIS.
Yeah, I think we can definitely do that. And I did expect that we would go back to EMIS because some of you may have joined late, and actually majority of London is obviously on EMIS, so we'll definitely do that. Any other sort of quick questions before I do that? And also, there's a bit of a sandwich effect. You know, you saw how to do settings. Maybe now, if you've got some questions, I'd rather answer some of the ones that we think we can answer before going back to showing you how to do the settings. So we'll definitely do EMIS. Redaction requests and star challenges. I think, first of all, at top level, what do we think about the acuity of the interactions with pharmacies? I do think they're relatively low acuity. They're not usually hugely sensitive. And even if you look at some of the pathways, maybe we think about child safeguarding, things like that. Actually, a lot of the pathways, they're not for children either. And I do think probably the most sensitive one is the contraception one, potentially, is my view. The patient gets asked by the pharmacist also whether they want to update the GP, so the patient can block it at that stage in terms of sensitivity. And like you've seen it often, for example, in TPP, it's hidden online automatically for the patient. So there are some blockers already put into the system to help manage some of those risks. Will we continue to, okay, just a moment, will we continue to receive emails? If you do nothing, you will continue to receive emails from the provider. We would also encourage you to think, are you definitely receiving them more accurately? If you've not seen lots of emails flood in, it is worth ensuring that you are set up correctly. You may want to reach out to your ICB pharmacy type leads. There was, for example, an issue where on one of the four pharmacy IT systems called Pharma Outcomes, used by quite a few pharmacies in London, some email addresses were not verified for some practices. It meant that you might not have been receiving reports reliably. So I definitely would encourage you, if you're not setting this up, make sure you really are correctly set up with your email address with the pharmacy IT systems. I'm gonna just quickly whiz off, if people don't mind, do a little bit of the questions before we go through the EMIS setup again. Can we have the NHSE contractual hyperlink? Yeah, we can share it. But I'm hoping also in this discussion, we're not thinking too contractual as well. I hope you see the journey that communication between pharmacy and GPs could improve experience for all. But we'll share that.
Shankar, there's a question: how much access of patients' records will pharmacy have?
They'll be able to see quite a lot. If you look at the structured record and you're ticking all those boxes, you could think that they can see the majority, if not all, unless you sort of marked as hidden or shared. The bit that they can't see is the attachment documents you may have uploaded. You might have seen at the beginning, and in fact, I'll go back and slide. You know, I mentioned we're not considering this GP Connect access record access document. If you did enable that, they can also see sort of documents that are uploaded in the GP record. Okay. There's a SystmOne question. If you choose the manual option, does it mean that we still need to do the task roll? I would say yes, it would definitely improve your processes to create the task roll.
Another question: can the patient see entries via NHS app whilst the documents are still in provisional mode?
No, not in provisional mode, but after review, potentially yes. Although, like I've shown in TPP perspective, you've got to also manually make sure you've activated it, that they can view it. This is similar. I mean, if some people are aware of things like, I mean, a SystmOne user may be used to things like auto-filing or pathology results. It's that same concept. In a provisional state, it's not viewable to the patient online. I think I've answered the main question. There is a really important data controller question, and by the way, by a really great Eshan, a great GP in North Central London. I hope you don't mind I've just named you anything. Really important questions. I'm going to suggest. I think it is a complex area. I think it's one of the elements that BMA would debate. Probably, I'm going to say it's outside the scope of today, because it's probably going to have to be a national response about that whole role and that view. But I think you're raising a really valuable point that a lot of people may think about. But I'd also go back a step, and I know it's not exactly the same. Remember I said about the point where if we got the email from the pharmacist, would you not paste it into your GP record? Or even if you put it into a task, like for example, SystmOne, it still forms part of the patient record. So do we still already have that dilemma anyway when we receive things by email and we put it in? I'm just putting it out there. I'm not saying that that's a correct position. And I'd also say a positional statement about maybe the future. There's a vision in the NHS 10-year plan of a single patient record. If something like that materialises, because at the moment pharmacies don't have their own patient record that they can share with other pharmacies. But if some of those things materialise, maybe this will all evolve in a different direction. Okay. There's a question about list of SnoMed codes. I think we can try to pick that up and come back to you with that list, and about whether we can block codes. When you get the report coming in, you can obviously decide whether you want to accept it or not. But that functionality about whether you can do each code or whether you have to do the whole consultation can vary. So you still might have some challenge whether you thought you've accepted it. There's one code that you didn't feel was appropriate, and you either have to sort of mark it in error. Do you need patient consent to enable it? No, you don't need patient consent. Patients can individually look at asking to block them with your normal settings. It's not a special setting. If they block sharing, it'll block this. But you're doing it at practice level. You don't need specific patient consent. What I do think, remember, the patient consent is happening more at the pharmacy end. So if the pharmacist is checking with the patient, they're happy for the GP practice to be informed. That's for update record, and the pharmacist is checking about can they access the record? Do they have patient consent? So you're not doing any patient consent at the GP end in this.
Shankar, there's a question. Why does the pharmacy need to see the record if they are only providing us the information?
I think we need to look at it as a two-way journey, isn't it? It's like us. Why do we benefit from seeing other consultations? For example, I'm just putting out there, what if a pharmacist saw a patient saw a GP this morning who was adamant they didn't need antibiotics, documented the consultation, and 2 hours later that patient walked in to a pharmacist and they see that entry? Could it shape their decision making? They assess them, they think the same thing, but they say the same perspective. A bit like how sometimes as GPs we get frustrated where we see the patient, they walk into an urgent care centre and 1 hour later they get an antibiotic. Could it actually help us be consistent? Would you have been annoyed with that pharmacist that they prescribed the antibiotic, but that was also because they couldn't see your entry 1 hour before, or they couldn't see the fact that the patient's pattern of seeking attention? It's similar with UTIs. What if a patient said something one way by walking in, but they could see things in the record which meant they thought, oh, do you know what? There's reasons why we shouldn't prescribe or do something differently. So I just think we've got to think of it as we're all one team, and how does information help us with our assessments and decision making? Okay, I'm going to assume we've answered most of the questions. What we could do is I'm just conscious about the EMIS users who might want to see this and then drop off back into their things. But if there are other questions, maybe we can pick it up at the end again. So let's go back from this is like this is a replay. This is like hit and rewind. So we're going back into the EMIS world. So GP Connect update record is the first one we want to enable. So what we're doing is, I just mentioned again that the Optum Health Centre has all of this there. So if you just scan this QR code, when you get the slides, you'll be able to click on the QR codes as well. Then you can access it. But here is my quick extracts from that effectively. So by default, you should be turned on when the functionality rolled out last year, but you might have turned it off. I'd recommend that if you're confused or you're not sure, just follow the guides and just check what is going on with your settings. So if you go to organization configuration, you go to edit organization, you get this pop up here. And if you go down to accept GP Connect update record via mesh, we need this to be set to yes, and then just click on OK. You might get a prompt to say you need to restart to EMIS for the change to take place. And what will happen now is you'll receive them via in workflow. So if you look at workflow manager, you'll see if you go on to click document management, they'll probably land in awaiting coding, and you'll see the details like this. If you just click on documents, I've just sort of shown what it might look when you say click on documents. It just comes into your workflow this way. And importantly, they are marked as external user in all cases. And this is how it looks like in EMIS. So this is a provisional consultation. So before practice has had a chance to review it, it just clearly marks it as provisional, and you can see it's structured with coded information, including the medication being coded as well. And that was EMIS how to enable update record. We're now looking at EMIS how to enable access record. And if you did start at the beginning, HTML and structured. As a recap, HTML is like a very basic view only type view of the record. Structure means it's really structured. Well, I'll kind of state the obvious here, aren't I? So coded, structured, far more user friendly to navigate for that health professional. Yet again, there is a web page in Optum Health Centre. So this is the QR code to get you to there. So from the EMIS board, you select configuration. You click on organizational configuration there. And then you're going to see here that you're going to go right down to the bottom, click organization, go right back up to the op and click edit, and then select GP Connect configuration. And then on in the edit organizational pop-up. And here you can see HTML view is the first one that you need to make sure is selected. And then you've got structured record below that you need to make sure is selected too. So those two things that you need to make sure are selected. And that is it. I think I'm going to not go through SystmOne again.
Yeah, there's also an ask for SystmOne in the chat, Shankar.
Okay, we'll go for it again. But before we go through SystmOne again, can I just also double check? Are there any other key questions we want to answer? Because I'm also mindful of people's time. I really appreciate how busy you are, guys.
There's a last question at the bottom.
I mean, there's one question. It'd be great to see their records without it coming into ours before we could decide what we want to do. I mean, one thing I would say is as EMIS users, I do think we've tried to flag one. I mean, it's not a perfect option, but SystmOne users have got the manual filing option versus automatic. I'm not saying that resolves all issues, but it could be one option that people sometimes prefer. So it comes into your workflow. You can review it before you file it in. So you could obviously then reject it or only save certain elements or even cut and paste bits, but it's a bit fiddly to do that. Have all pharmacies in England been onboarded? Yes. So all pharmacies in England have to use one of 4 IT systems as part of their contract with Pharmacy First. All 4 of those systems are now functional with GP Connect update records, so all 4 of them can send it across. That was not the case last year. It was in a phased fashion, but I can definitely say to you right now, all 4 are live. So it also covers the fact that if a patient goes on holiday somewhere out, well, I'm a Londoner, so anywhere outside London is totally far away for me. Basically, go anywhere in England, then basically you will get it. So there is that benefit too. Can we make yes, I've got a question. Can you make yes, you can make the configuration changes now. If you think I've made it clear to you, go for it. Exactly what we'd like you to do. We don't have the option to connect via mesh. I'm not quite sure I understand that question. Maybe if you want to expand it, technically GP Connect does use sort of elements of mesh to send it through, but it's just coming through in like a different package. I'm not going to try to explain it any more than that. It'll confuse everyone. If there's no more burning questions, I'm going to go through TPP SystmOne again. Do feel free to drop off. Otherwise, please do post on the chat. We'll try to pick them up again after we go for TPP. Yes, it'll be in the slide deck, the link to Optum Health. So you can see it in the slide deck. It'll be interactive. The slides will be clickable. We'll really try. I'll even try to make sure we upload something in this chat as well. So you'll get it in the chat as a slide deck. Okay, so SystmOne users, and I'm assuming that's mainly us in Northwest London and a few in Northeast London. What you need to do, so we talked about GP Connect update record. Again, a bit like EMIS, there's a help page. This one you don't need to log in to get to. It has a video walkthrough as well. So definitely give that a look if you want to understand more. So GP Connect update record, to enable it. Now, remember, it should have been enabled by default, but you might have adjusted the settings. So definitely would like you to check what is your settings. Go to organizational preferences, go to interoperability, go to incoming messages. So that's down here, and then you can see that it's set on file automatically. That should be your default. That's what we would encourage you to leave it on. That means it will be provisionally filed into the patient's record before you even review it. But if you didn't want that option, again, you've got a second one, the option above it, which is here, that allows you to really effectively do manual filing. So it creates a task for manual filing. So when it comes in, it comes into your task queue. You don't have to, look for it. It will come there. What I did remind to SystmOne practices is I'd recommend a task rule, and this doesn't matter, just answer that question in the chat, it doesn't matter what setting you go for, automatic or manual, put a task rule in like this. So things of that task category, which is a new task category, we're not familiar to that. That's a new task category because of GP Connect update record. If we could just go on mute, that would be really helpful.
If you're in the meeting.
Okay. And
I'm not. No.
Okay. I'm going to let them, because if we could just mute. Okay, brilliant. So basically, you may want to assign it to a particular team. Can I get someone to mute that person without being too rude? Okay, right. So GP Connect update record task, might you want to send it to a particular team? If you're using user groups, please do consider moving over to SystmOne Teams, not to be confused with Microsoft Teams, because all the functionality in SystmOne is going in the direction of using Teams. And that's how they arrive as a queue of tasks. And it will have a different sort of categorization showing whether it's a blood pressure, minor illness, or contraception service. When you get the tasks, you can't action them in bulk. You have to go them one by one. I did get a question from a user about, why is that? And I can see pros and cons. We can definitely raise it as a development request. I can see that if you did it in bulk and they're flashing past you, maybe, although they're not meant to include actions in a task, what if there was an action or raised blood pressure reading or something you did want to look at? So I can see the pros and cons of it, but something we can definitely raise a development request about some of those options. And that's how it looks like I showed for SystmOne users as a structured consultation with a structured message with lots of coded information. And for TPP users, access record is the second thing to enable. And there's two bits to that, HTML and structured. HTML, if I'm going to sound like a broken record, HTML is that view like only, like think of it as just not so helpful text, like a PDF type document experience, where structured information is that it's coming across to that other user with coded structure, and they can jump around sections. So it's far more user friendly. So what do we need to do as TPP practices when we need to go to organizational preferences, go to interoperability, go to third-party patient record settings, so all the way down here. Then we got to select these three. So we got to select enable access record, HTML. We need to select enabled access structured rectal provider, medications and allergies. And then finally, we need to select that third one, which has got a whole long list of immunizations, consultations, problems, investigations, outbound referrals, diary entries, and the uncategorized data. Thankfully, that is just one tick for all of those. And that is effectively what TPP practices need to do. And I do feel duty bound to very quickly say Medicus again, because to keep it fair, that we've heard all three twice. So with Medicus, the first thing I mentioned was it's not yet live with GP Connect update record, but effectively automatically flows through mesh, the pharmacy consultations, but not yet as a structured coded consultation. So it will appear into inbound documents. And the flip of that with access records, you can enable it. It's now ready for rollout, and they're starting to roll it out. So you go to third-party data sharing, GP Connect configuration screen, and you go to enable access record HTML, and then you need to also enable access record structured. And you have to click that whole long list. So TPP users have just one click to do all of it. Here, Medicus is allowing you to click all of them individually. And there we have it. Okay, right. So are there any final questions? I left us on this last slide before. Yeah, well, thank you, Ishani. You gave us this last bit, this last slide with your World Pharmacist Day. So what are there any burning questions that people would like us to discuss before we close? I'm going to assume not. So, like I said, I mean, I'm going to go back a slide. I'm not here to tell you what to do. I'm here to nudge you. I'm really here to nudge you. You know, like this gap here, I'm reaching out to you to think of some personal views, make a decision. But I think if you're really struggling with the decision, forget everything else. Just think what would be best for the patient in our practice and go with what you think is best. And let's be all open to this may evolve, things may improve. It's constantly improving. You know, that is a journey, and we'll really try to help with any significant updates to functionality as they arrive, so you feel that you're engaged with progress. I'm going to let it close there. So thank you ever so much for taking some busy time out of your day to join us. We are going to repeat this again on, I think, around the 7th of October. You know, also as a checkpoint, if you've got some real questions or things or issues that you've encountered, or, you know, practices that haven't switched on but want some help, you can signpost to the second webinar. We'll also share this recording really quickly if that's helpful for you too. So thank you so much for your time. And please do have a slightly less stressful afternoon if you can in primary care. I know that's not an easy ask. And have a great day.